activities, acting as a liaison with external agencies and groups like ourselves on issues relating to autism. Before this work, Dr. Daniels was a health scientist administrator at the National Institute of Allergy and Infectious Diseases, where she worked on a variety of issues and managed a portfolio of research, training, diversity, and conference grants. Before that, she also worked at the National Institute of Neurological Disorders and Stroke, NINDS. Before coming to the NIH, Dr. Daniels was a Science and Technology Policy Fellow and consultant at the National Academy of Sciences. She received her PhD in molecular and cell biology from Brandeis, and her research is focused on the neurobiology and genetics of the sensory nervous system's response to environmental stimuli, clearly of interest to those of us working in the area of autism. So with that brief introduction, I'm delighted to turn this over to Dr. Susan Daniels. Susan, thank you so much for being with us.
Thank you, Jim, for that kind introduction, and thank you so much for the invitation to present to this group. I really look forward to interacting with you and will be very welcoming of any questions that you might have after I finish my presentation. So I'm going to go ahead and tell you a little bit about what we do in the Interagency Autism Coordinating Committee. Let's see if I can get, there we go. So first, to start off, I want to tell you a little bit about the office that I work in. So I'm the director of the Office of Autism Research Coordination, which is an office that was set up within the National Institute of Mental Health to coordinate and manage the Interagency Autism Coordinating Committee and to help coordinate cross-agency autism spectrum disorder initiatives and activities. The OARC provides assistance to the IACC by helping the IACC communicate information about itself and about federal research and services activities to Congress, to other government agencies, and to the public. It coordinates cross-agency efforts, so our office is often in the middle of coordinating between different agencies and helping put together maybe joint documents for those agencies related to ASD. Planning meetings, conferences, town halls, etc., different types of venues where the public and the IACC can come together and interact and share ideas. We also assist the IACC in its strategic planning activities that are required under the law, and with the research monitoring activities that are required. Our office actually conducts analyses and prepares reports for the IACC and for Congress, analyzing various trends in research and services, etc., for autism. We gather public input on issues related to ASD to inform the committee's work. So our office sometimes puts together formal requests for information to the public so the public can send in information that they feel that would be important for government officials in the IACC to see. We also gather general public comment at the meetings and sometimes hold town hall meetings to get members of the public together to be able to share their concerns and thoughts about ASD. We also develop and disseminate information about ASD and about the IACC to the public. So we're kind of behind the scenes, and we're a support to the committee to enable it to do its work. Whoops, sorry, I advanced one too far. So to start off, I wanted to give you some background about the legislation that undergirds the activities of the IACC. The IACC was first formed under the Children's Health Act of 2000, and that act established the IACC to coordinate activities within HHS, including both NIH and CDC, and that law also allowed the membership of the IACC to include other federal agencies and parents of individuals with ASD, but it didn't delineate too many other requirements for the IACC. It was there as a body to help with coordination. And that went on until 2006, and in 2006, Congress passed the Combating Autism Act of 2006, and that act reconstituted the Interagency Autism Coordinating Committee in order to enhance federal coordination of autism efforts and provide priorities and accelerate the pace of autism research. And this law, in the reconstitution of the committee, made it into an official federal advisory committee that's subject to the Federal Advisory Committee Act, and that sets down different legal requirements for the committee. And one of the practical outputs of that is the committee has to be very transparent and open to the public, and so all of the meetings that we hold are open to the public, and we provide information about all of the documents and activities of the committee on a website, and the committee is open to having people attend all of the meetings, and all our phone calls are also open. So that is part of the Federal Advisory Committee Act. The Combating Autism Act also specified the membership more carefully in terms of the members that would be included, and it expanded from just parents and legal guardians being named in the Act to also including autism self-advocates and leaders of national service, research, and advocacy organizations. The committee also had some other new members that included other stakeholders, including researchers and service providers. So it became a larger committee. The first committee was around the size of 18 to 19, and during the years of the Combating Autism Act of 2006, expanded to being closer to about 30 people. In 2011, the committee needed to be reauthorized because the Combating Autism Act expired in 2011. And so the reauthorization is called the Combating Autism Reauthorization Act, or CARES, and that renewed the IACC through 2014, and that renewal date ended on September 30th, 2014, so really just a short time ago. Many of you may have heard about the Autism CARES Act of 2014 that was signed into law by President Obama on August 8th, 2014. This stands for the Autism Collaboration, Accountability, Research, Education, and Support Act. And this new law reauthorizes the IACC and other programs that are mentioned in the law through September 30th, 2019. So it's a 5-year reauthorization. And it establishes, among other things, a National Autism Spectrum Disorder Initiative within HHS, which will be led by an official who is charged with implementing federal programs that reflect parts of the IACC strategic plan throughout HHS, and ensuring that HHS activities are not unnecessarily duplicative with those of other federal departments and agencies. And so that's one of the new provisions in this new law. It also supports the continued efforts of the IACC to advance ASD research, which was a major focus of the IACC under the Combating Autism Act. But it also has a new aspect in that it incorporates an increased focus on services into various activities of the IACC. So that would include, for example, the strategic plan of the IACC. It also provides additional criteria for membership, essentially just expanding the specific number of each of the categories of self-advocates, parents and legal guardians, and stakeholders who represent various autism advocacy, service, and research organizations from one of each of those to 2. And essentially already the previous committee already had 2 or more of each of those categories anyway, so this just lays that out more clearly in the law. And it also incorporates a significant emphasis on the needs of adults and transitioning youth, and requires HHS to provide a report to Congress on this specific topic. And so that will be something that will be new. And that, sorry, to be more clear, that report will be required of HHS but not of the committee. And so HHS will be putting that together, a study on transitioning youth and adults, and then issuing a report. The previous Combating Autism Act also required a report to Congress, and our office was charged with coordinating that report 2 different times, and so we published that report in collaboration with all of the agencies that have been involved in this effort in 2010, and then a new report in 2014, which I'll mention later. So what does the IACC do? It's in charge of coordinating and monitoring federal and non-federal activities. Actually, in the law, it specifies federal activities to be coordinated and monitored, but because there's so many different public stakeholders from various organizations that are doing so much work in the area of autism, it's really more of a collaboration, and non-federal activities are also looked at very carefully to ensure that we are partnering, the federal government is partnering well with private organizations, and that there is limitation on duplication of effort. Also, the IACC gathers public input, largely through some of the work that the OARC does to help support that. The committee produces several different advisory documents that can be used by federal agencies and also by outside organizations that are planning for autism efforts. The committee provides advice to the HHS secretary and makes recommendations through its strategic plan and through a number of different documents and reports that come out of its meetings. And the committee provides a forum where members of the public can come in and discuss issues that are related to ASD and that are important to the ASD community. And this is a way for the federal government to really be getting input from the outside constantly and feedback. What the IACC does not do is it does not fund research. So the IACC does not hold a budget for research. It doesn't fund any grants or contracts, and it doesn't control research funding. It does not set policy, and it does not create any laws or policies, and it does not have authority to force agencies to fund specific projects or set specific policies. All of its role is advisory, and it brings together the ideas of both the public stakeholders and the federal officials together, creating various documents that are advisory, and this in turn can be used by federal agencies to guide their planning. So the IACC's role is to bring federal agencies and public stakeholders together to coordinate and focus efforts to accelerate progress. How does the IACC operate? The IACC is required to hold 2 meetings per year of the full committee, and so we've been doing that, and actually the committee usually meets in person 4 times a year in January, April, July, and October, and usually ends up having extra meetings in November and December around some of the strategic planning process. And the committee also forms subcommittees and planning groups that allow it to work on specific projects, such as the strategic plan update or other kinds of projects. And the meetings include a variety of different presentations from experts and community members, and all the full committee meetings also have a session for public comment. And something to note, as a FACA committee, all of the products that are produced by the committee must be discussed and approved by the full committee. So even though some of these working groups and subcommittees are doing the legwork to put together documents, those documents all have to pass through the full committee and be approved by the full committee before they can become official IACC documents. So I wanted to give you an idea of who has served on the IACC recently. As you know, it has expanded from the original 18 or so members to being around 30 members. And so this is a slide that shows you the recent IACC membership from 2012 through 2014. On the federal side, we had the directors of several NIH institutes that are deeply involved in autism research, including the National Institute of Mental Health, the National Institute of Deafness and Other Communication Disorders, the National Institute of Environmental Health Sciences, the Eunice Kennedy Shriver National Institute of Child Health and Human Development, and the National Institute of Neurological Disorders and Stroke, as well as the NIH director, who was often represented by the director of the National Center for Complementary and Alternative Medicine. And we also had representation from several other agencies, including the CDC, the FDA, HRSA, DOD, and from the Administration for Children and Families, CMS, the Department of Education, and the Administration for Community Living. So you can see that really the committee, the federal side, represents both services and research. And on the public stakeholder side, there was quite a diverse group of various autism self-advocates, autistic adults, also parents and legal guardians of individuals with autism spectrum disorder, in addition to representatives of major foundations and private organizations that fund research, services, or other advocacy activities. And so I won't read off all of the names, but you'll recognize a lot of these people as being very prominent contributors in the autism field, and very generous with their time to help the committee in its deliberations and its process. So to share with you some of the IACC core values that were developed early on in the committee in 2006, or actually really in 2007 because the committee really got going in 2007, were the sense of urgency, a commitment to scientific excellence, a spirit of cooperation in spite of many diverse viewpoints around the table, a focus on the issues that are important to consumers or important to patients and other community members, a commitment to partnering between federal and non-federal organizations, and an effort to create goals that are that reflect accountability. They created SMART objectives in their strategic plan that they wanted to have them be specific, measurable, achievable, realistic, and time-bound. And ultimately, their goal was to find common ground among all of these different diverse viewpoints to come up with the best advice they could provide for federal agencies and others who would be looking to this group for guidance. So the responsibilities that are laid out in the law for the committee include developing and annually updating and submitting to Congress a strategic plan for autism spectrum disorder research. And I will be telling you a little bit about how that process worked from 2006 on. They also have to develop and annually update a summary of advances in ASD research and monitor federal activities with respect to ASD. And that's under the law, it says federal activities, but the committee has also been watching non-federal activities because they are such an important part of what is happening in the autism field. And truly, if you're monitoring only the federal side, you'd be missing a great deal of what is happening. The committee also makes recommendations to the HHS Secretary regarding research or public participation in decisions related to autism spectrum disorder. And the law, as I mentioned, requires the group to meet twice a year, and usually they meet several more times than that. I think on average, if you count the full committee meetings plus subcommittees and planning groups, we usually have about 16 to 17 meetings a year. And under the new Autism CARES legislation, there are some updates. The strategic plan will now have to include a component on services, so that will be part of the charge of the new group that comes in. And the monitoring will also extend to services to the extent practicable, is what it says in the law. So within some reasonable limits to try to make an attempt to monitor federal activities in the services area as well. And this will extend to recommendations in addition to that. So there will be a whole new component that will have more emphasis. The first IACC strategic plan was completed in 2009, and the IACC wanted this new strategic plan to focus, coordinate, and accelerate high-quality research and to create a research environment that would really be focused on answering the urgent questions that consumers have about autism spectrum disorder. In the IACC strategic plan, there have been 5 different versions that have been released to date. So each year the group has been doing an update on the strategic plan, and the overall vision for the strategic plan is that it will accelerate and inspire research that will profoundly improve the health and well-being of every person on the autism spectrum across the lifespan, and that the plan will set the standard for public-private coordination and community engagement. The research areas that are covered in the IACC strategic plan currently are these 7 areas: screening and diagnosis, which is covered by the question, when should I be concerned? The second question is, how can I understand what is happening that is about the underlying biology of ASD? What caused this to happen, and can this be prevented? Concerning risk factors for ASD. Which treatments and interventions will help, which is pretty self-explanatory about treatments and interventions. Where can I turn for services? Also pretty self-explanatory. What does the future hold, particularly for adults, to address the lifespan issues and issues in terms of transition and aging? And then the final chapter captures a number of different areas, diverse areas, including infrastructure, workforce training, data sharing, and surveillance. And overall, within these 7 question areas, there are 78 research objectives in total in the strategic plan that lay out very specific goals that the IACC wanted to see achieved within the next few years. So in this last year, the committee decided that they wanted to provide a 5-year update on the progress that the community has made towards the IACC strategic plan goals. And so they did a careful analysis looking through the IACC portfolio analysis. They looked through the data that our office collects from all of the different research funders to identify which projects met which of the 78 objectives. And so our office actually did that analysis and presented it to the IACC to help them in their deliberations. The strategic plan update also includes information about the funding that was allocated to each objective of the IACC strategic plan and the assessment that the committee made of which objectives were met, which ones were partially met, and which ones did not meet recommended funding levels. And in terms of the funding levels, those are budgets that were recommended by experts in the field for achieving the goals that the committee set. And in the strategic plan update, you'll find an assessment of key research findings and progress, remaining gaps in knowledge, emerging needs and opportunities, and progress that's being made towards achieving the aspirational goals. And so each of those 7 areas has an aspirational goal that the committee set. So to just walk through a little bit of what the findings were of the strategic plan planning groups, they found that when they were looking through the data provided by our office and all of the research agencies that participated in this process, that $1.5 billion were expended by federal and private research agencies and organizations between 2008 and 2012, and that there were advances made in all 7 strategic plan question areas. And examples of the advances that they identified through their process, they also invited experts to come in and talk with us about some of the advances that are being made. But some of the most significant ones were including improvements in screening and diagnosis approaches that are enabling now that children can be diagnosed by the age of 24 months if these approaches are fully utilized. More data supporting the efficacy of early behavioral interventions, data from the Baby SIBS Consortium and other studies that are helping us better understand the early development of ASD and its underlying biology, more knowledge about both the genetic and environmental risk factors involved in ASD, new guidelines to help families and clinicians address comorbid or co-occurring conditions in individuals with ASD, which I know many of you know a great deal about because you've been deeply involved in this, and more knowledge about services, barriers, and outcomes. So those are some of the key areas in which progress has been made. And the committee also identified some overarching goals that they feel will help accelerate progress in the next 5 years. And these included including individuals from the full range of ASD disability, from all periods of the lifespan, and from underserved populations in research. And moving from observational research, especially regarding issues such as health disparities and services, to research that will really work toward developing strategies to address these issues. They talked about adopting more of a practice-to-research model and encouraging study of real-world practices in order to inform research. The need to scale up screening tools, interventions, and services approaches for use in community settings. The need for development of a personalized medicine approach to interventions and services that could take advantage of some of the new technologies that are available, including genotyping, subtyping, and phenotyping, as well as comorbid health conditions or some of the technologies that will enable those things to be improved over the next several years. They also talked about the importance of trying to apply strategies that have worked in other fields to ASD research, leveraging existing infrastructure in order to increase research speed and efficiency, focusing research on practical outcomes such as effectiveness in community settings and improvement in quality of life, and developing standardized outcome measures. So those were some of the areas that they prioritized for future efforts. And I mentioned some of the data that we've been collecting in our office. Our office is currently working on producing this report, the 2011 and 12 IACC portfolio analysis that has been outlined already in the strategic plan update in more general terms, but in this report it will have more detail about the specifics of how the different funding agencies are meeting strategic plan goals. And so this report, it's a report that our office puts out every year or two, assists the IACC in fulfilling the Combating Autism Act requirement to monitor federal activities related to ASD. It provides comprehensive analysis across both federal agency and private organization research portfolios. It informs the IACC and stakeholders about the funding landscape and current directions in ASD research. It provides, this particular report is going to actually provide an overview of the 5 years of research, which has already been done in the strategic plan update, but this will be much more detailed and will help the IACC in its monitoring activities. And it also will highlight gaps and opportunities to guide future activities. And all of the information that is published in this volume will be put into a database, which I don't have a special slide for, but we have an IACC portfolio analysis web tool that is available through the IACC website, and any member of the public can access it and look up information about the research projects that have been funded and see how those relate to the IACC strategic plan. So those will be put out concurrently. And we're actually working on the next couple of years of data collection and being able to do that analysis, and hoping actually that we can move to some kind of an electronic platform to make it easier to collect the data. In the upcoming report, we're going to be showing some of these data. In 2012, the total funding for ASD research, including the work of 21 different funders, was $331 million. And that was up since 2011 by $32 million. However, if you really look at it in a 5-year time frame, you'll see that there are some ups and downs, and especially in 2009 and 10, the federal government had an infusion of funding from the American Recovery and Reinvestment Act era that did create a bump in funding, and so there has been an apparent decrease because of the end of that period of funding, but since 2011, it started to come back up toward that level. And this is just a listing of all of the research funders that were involved in our portfolio analysis effort, all of the federal agencies and private organizations that so kindly and generously provided all of their data to us for this analysis, and the total funding and projects in each agency and organization. And the distribution of funding across all of the IACC strategic plan questions is portrayed in this figure, which might be of interest to some of you. Some other publications that the IACC has put out recently include the 2013 IACC Summary of Advances that was published in 2014. We always have to publish the previous years in the following year because you have to wait until that year closes before the committee can evaluate the research that was done in the previous year. And so what the committee does is they look through the publications of the previous year and select what they feel are the top 20 advances that were made. And then our office provides a lay-friendly summary of each of those papers in this volume. And so this one is available. And when the IACC comes together again, that will be one of their top agenda items, is to complete the Summary of Advances for 2014. In the last couple of years of the IACC, they also issued a statement on the DSM-5 because this was such a hot issue within the community and a lot of debate and concern about the updates to the DSM criteria for ASD. So the IACC issued the statement regarding the implications of changes to the diagnostic criteria, and they divided this document into sections on research and a section on practice and policy. And the key points that they had in this document were recommending research to further assess the reliability and validity of DSM-ASD criteria, and to try to understand the potential impact of these new criteria on several areas of research, including diagnosis, prevalence estimates, and access to services. And they also really emphasized to providers and community members that services should be based on need rather than diagnosis, and that it was very important to make sure that people are having their needs met regardless of which diagnosis they may receive under the DSM. The committee also wrote a letter to the Secretary in 2013 on health coverage for early intervention, recommending that in light of the strengthening evidence for the effectiveness of early interventions, that they recommended coverage for coverage of and broad access to these treatments for children who have been diagnosed with ASD, and recommended availability of coverage of early behavioral interventions for children who are insured both through private insurers as well as those who are insured through Medicaid. And this letter has been used by people in many states to inform their legislators and other officials who are working on autism policy and coverage policy. So this document has had wide use and has made an impact in certain states. I wanted to briefly bring to your attention the most recent report to Congress that was put together by HHS through the activities of my office, as well as all of the different federal agencies that are involved in autism research and services activities. The Combating Autism Act report to Congress, fiscal year 2010 through fiscal year 2012 report, was put out this year. It's a 100-plus page report that includes information on autism-related activities and programs across all of HHS, the Department of Education, the EPA, the Department of Defense, and the NSF, the National Science Foundation. And this is available online on our website. And with all of our publications, we also have hard copies that are available if you write to us and ask for them. So what's next for the IACC? So the current committee's terms expired on September 30th, 2014, as specified in the Combating Autism Reauthorization Act. And so the very next day, our office issued an open call for nominations, and members of the public were invited to put in nominations for members of the public who wish to serve, and especially encouraging members who may be on the autism spectrum or are family members, parents, legal guardians, or are deeply involved in advocacy services or research to submit nominations for themselves or to submit nominations of others. And so the open period for nominations closed on November 14th, so just a few weeks ago. There were about 100 public member nominations received, and now it will be up to the Secretary to go through those nominations and select new public members to serve on the committee. And we're also in the process of reappointing federal members to represent the various federal agencies. We are anticipating that the new committee will be announced in 2015 and will begin meeting as soon as possible, and we actually already have some potential dates for a meeting as soon as we hear who has been selected and we are able to go through the appointment process. And the new committee will be charged with updating the strategic plan, and this will include adding new information on services activities and continuing to monitor all federal activities, including both research and services to the extent practicable, as it says in the law. And so we don't know all the specifics of what the committee will work on, as the group will bring to the table many of their own individual needs, concerns, things that they've heard in the community, and will come together and deliberate what are the directions that will most help the community to move forward, and how federal agencies and private partners can partner together and move forward on autism issues. So we really look forward to having the new committee start meeting in 2015. So that's the end of my formal presentation here. I wanted to briefly acknowledge all of the members of my office who are very diligent and hardworking and work behind the scenes to make all of these documents and meetings come together, and we really look forward to working with the new committee and continuing to reach out to the community and engage with everyone on how to move things forward in autism research and services. So I would be very happy to take questions and would love to hear from you. So Audrey or others, please let me know if there's anything I can answer.
Thank you so much. Okay, just one second.
Audrey, I'm sorry, Susan, thank you so much for that really wonderful presentation. And it does sound like there's been a lot of really interesting progress that the IACC has helped to monitor and, frankly, to enhance. Can you tell us a bit more of where you think the IACC will be going in the area of services for children with autism?
Well, I don't have a lot to say because a lot of that is going to really come out of the committee itself, and we'll see what issues and concerns the committee brings forward. Certainly through the last year's strategic planning process, the committee identified a number of areas in the services arena that need to be addressed. They talked about samples, scalability of interventions, and increasing the opportunities for partnering with ongoing efforts. So I think that there are a number of different directions they could go. They certainly got quite a bit out of this recent evaluation of 5-year progress, and I think that will be used as a guide to help determine the next priorities. But as you can imagine, with all the different individuals with diverse backgrounds and interests, it could really vary depending on who's appointed to the committee and what the groupthink ends up developing. We also do plan to conduct a request for information about services, and that's something that we will be putting out in 2015 through my office. And I'll be happy to be in touch with you all about that RFI as maybe members of this community would like to contribute to it. So the goal would be to collect information for the IACC so that when they start working, they can hear from the community about what are some of the most pressing issues that need to be addressed.
Great. Let me see if there are other questions from the folks on the phone.
I don't have any questions coming in. Does anyone have any questions?
You remember, you can raise your hand electronically if you want to. So Susan, our network under especially with our funding from HRSA, is expected to provide more information about current practices of pediatricians with respect to routine screening. So that's one area that we're trying to work on at this point. But another is that the network is really increasingly working with primary care physicians, at least in the communities in which we have centers, to try to share more of the ongoing service needs of children with autism and their families. So these are a couple of areas that our network is working on at the moment.
That's great, and I think that we will be coming to you all looking for a presentation about some of the work that you're doing to keep us informed, keep the committee informed of your efforts. So I'm sure that they'll be interested in hearing about that.
Great. One other thing we're working on at the moment is we're putting together, I think you may remember that in 2012 we published a supplement to pediatrics around a series of issues in autism intervention research especially. Mm-hmm. So we're in the midst of really following up with that with another supplement that we expect will be published most likely in the fall of 2015 at the moment. But Lonnie Zweigenbaum from our network and Margie Erickson-Warfield from Brandeis are working as our sort of associate co-editors for that work as we move forward, and we're already in the midst of reviewing manuscripts for that. We're pretty excited about it. Another supplement that really is a good deal more sophisticated and farther along in our progress than was the one in 2012.
Well, that's wonderful. I know that the 2012 one was discussed in the committee, and I think that they will definitely be looking forward to hearing about that as well.
Great. Are there other questions from folks listening on the phone?
So we do have one question. Is there a list of more accepted standardized outcome measures that you could speak to?
There isn't one that's available, but that's a need that the committee identified for the future. And so the committee was interested in trying to see what they could do to help that. They didn't end up putting together a specific activity to work on that. I guess they decided when they were thinking about that issue, they were also thinking about co-occurring health conditions, and they ended up deciding to do a whole workshop on that issue this past fall. But I think that they may be wanting to follow up on that in the new committee.
Okay, great. Thanks.
Thank you so much, Susan, and thank you for those of you on the listening group today, too. We really so much appreciate the incredible work the IACC has done, and it's really helped to galvanize attention to and work in the area of improving the lives of people with autism spectrum disorder. So thank you very much for that work.
And thank you for your work. It's really critical, the different things that you're all doing, and we really appreciate your efforts and willingness to share with us what's going on. And so we'll be looking forward to interacting more in the coming year on these autism efforts.
Splendid. Great. And for everyone, a happy holiday season, and we'll be having our next session in January. Audrey, any parting comments?
Just to stay alert, I'll be sending some information about the January webinar, and also just a reminder that CME credit is available, and an evaluation will be sent around after the completion of this webinar, and it just is a simple evaluation, and it's submitted for CME credit for anyone who's interested.
Very good. Well, thank you all, and take care.
Thank you.
Thanks.